So, our wound team over the last couple of years has grown by 3 times the size it was previously. And really the work they have done to improve the outcomes for our patients in relation to their pressure injuries, in relation to their ostomy care, has been nothing short of remarkable. They have taken a scientific approach looking at the best evidence and the best practices that are out there. They've gone side by side at the bedside, so they're elbow to elbow with the frontline caregivers, both nurses and physicians, nutritionists, respiratory therapists, looking at how can we better take care of our patients and how can we best protect their skin.
My name is Chris Navis. I'm the Director of Clinical Practice and Patient Safety. So I oversee the Nurse Education Safety Specialist Group and the Wound Ostomy Nurse Group. I've worked at UMass for just over 6 years. I nominated the wound nurses because, in all actuality, they're a relatively newer team to the organization, so not necessarily the wound nurses, but this team is about 1.5 years old. There are 7 of them that make up the team, and they are very patient-centered and patient-focused. Everything that they want to incorporate or anything that they want to change from our formulary or to best practices is all patient-focused. So one of the initiatives that the team implemented over the past year was the sacral Mepilex, the preventative sacral Mepilex in the ICUs. It is considered a best practice, and we have seen a significant improvements in our pressure injury numbers in that area, which comprised of probably around 55% of all of our pressure injuries in the ICU. So we've seen a significant drop in that. On top of that, our wound formulary, we are actually introducing new products that are more appropriate for our patient population.
My name is Katie Benton, and I'm one of the wound ostomy continence nurses. I've only been at UMass Memorial for about 1.5 years. I'm actually fairly new to our team. I really like it. Our team has undergone a lot of changes. We've had a lot of growth. I felt like I was welcomed in with such open arms, and it's been a really good experience. Really fantastic, because we've really done a lot of good work in the past year and a half. We've done a lot. We've grown and changed a ton. We all work really, really well together, and I'm excited to find out why we were nominated today. I really love our team. We all really do enjoy each other's company. We have a really strong team. We all bring different strengths to it, and we've all come from different backgrounds. And Linda's been here for a long time, 20-something years, and has been incredibly welcoming to all of us. She has kind of brought us all into the fold so graciously, and we all have brought our own strengths with us, and together we've collaborated to make this amazing, powerful team where we can really make some impacts for patients and for their families. We recently implemented the WTA program, which stands for Wound Treatment Associate. With that, we've been training our bedside nurses and our educators to be more equipped to treat wounds. As a group, we've kind of put out this program, and we've been teaching everybody how to give better wound care, which has been really fantastic because for the bedside nurses, it increases their professional growth. And for the patients, then they get experts at the bedside when we're not always available for each patient, which has been fantastic. We're at the bedside, so we're providing that bedside care to patients, but additionally, we're able to provide that additional excellent care by doing staff education and working with our doctors, working with the treatment teams to be able to make a better experience for the patient as a whole, not just at the bedside, but by changing systems as well.
Linda Olson from the Wound Ostomy Nursing Team. I've been here technically 33. I left for a very short time. I started here as a new grad, back when you were a new grad, and I've been doing wound ostomy nursing for about 23. I love that there's some administrative nuances as well as direct patient care. I know that administration is focused on decreasing patients' pressure injuries to decrease patient harm, and I know we have worked tremendously hard as a team over the last 1.5 years. I think they're great. I really do. I enjoy it. I bounce off ideas, and we step up for each other, and we're able to implement things. We're all so unique in what we bring forward and what our strengths are. It was a very dark time, and we adjusted. We had to think outside the box. We are doing research on our own time, looking outside the box as far as patients in the prone position, what has worked, what are other facilities, what are our governing bodies, what are they saying? So taking a look at all of that and bringing it forward and implementing much of it, I think that's, and still to this day, we're able to do that. I think it's affected tremendous change in response and product. We're just all humbled, and I can't believe we're nominated. This is phenomenal, phenomenal.